My name is Reina Jara and I work in Latin America and Caribbean. The sector I'm going to mention is called Breaking Barriers, an analysis of the post-obstetric events. To know more about this initiative, I have three panelists I'm going to introduce them. We have Rodolfo Gomez. He is a sexual advisor for the Pan American Health Association. We have Edgar Narvaez. He is consultant for sexual and reproductive health systems, and Jeff Balacro. And finally, Fernando Ruiz, research advisor of the Regional Hub for Latin America and the Caribbean of ICFP 2013. I'm going to ask you a question and you have to reply in 2 minutes. Why it was important to do an analysis of the bottlenecks to consider post-delivery and post-obstetrician services in Latin America and the Caribbean. The problem of institutional births in Latin America is not controlled in Latin America because more than 95% of deliveries and abortions are seen in the public health system. This is an scope where the woman is in contact with the system, and it happens usually without any kind of advisory and no method. This is why it's very important to train the human talent. We have no more than 60,000 professionals being trained in our environment. But also, we needed to understand why having trained staff, which had different characteristics, which were very efficient, where people get through the health system at least once in their life, why this was not happening, which was the problem. And this study gives us a very important light. So it gives us light to the consortiums and organizations that put lots of professional intention. This is going to give us light on how to implement the changes. Many thanks, Rodolfo. Now, to understand implementation, we are going to the second question with Edgar. Edgar, which are the more important analysis of the Indian countries? The analysis was done in 8 countries of the region, and they give us a picture of what is happening. First, we find a problem related with information and counseling, as mentioned by Rodolfo, for pregnant women during different moments of their life, such as perinatal attention or before pregnancy, that allow to identify which were the opportunities, the services that they would have available. We also find weaknesses in the different regulation programs that were not updated, and they had no information regarding contraception for obstetric events. There's also a weakness in the different skills for the staff after delivery, which required to work in different skills. And finally, there is a more weakness regarding supplies in the services where deliveries attended, or where the cesareans are done, the C-sections are done. They can even go to the drugstore, but the medications are not present. So it may happen for the moment that the things are required. To summarize, these are the main bottlenecks identified, from which we generated some recommendations for the actions. Thank you very much, Edgar. Now, to understand how we did in Colombia with this implementation, let's go with the next question with Fernando. And which are the main conclusions for Colombia? This study was done with Profamilia in this consortium, and what we found for Colombia, we found 7 specific bottlenecks. First is lack of surprise. Second is the third is we found a weak community proposal of family planning after delivery. Fourth was the low diffusion of innovation. Fifth, limited capacity and training of human talent in this subject. Sixth, high turnover of sanitary staff. And 7, lack of community participation for the promotion of sexual and reproductive health. For this, we propose 3 recommendations which have impact. First, strategic planning and financing, which includes IPO in all the routes. Also to promote dissemination of training on sexual health and education, to train the staff, and also to strengthen participation of the community, including all the genders, so that nobody is left behind. Thank you, Fernando. Now that we have some time, I'm going to invite you for 30 seconds to a call of action. The most powerful call to action in 30 seconds is do not forget the health professionals that women have a need about contraception, and it is in front of you, and you have all control to talk about the wonderful things. Do not take on these opportunities. Call of action, please. One recommendation which is essential is attention after delivery is a very effective action. It's a cost-effective action. We talk about the different exercises, and the immediate contraception are an accelerator to be able to reduce the demand and to improve the prevalence of contraception methods, which are going to contribute to reduce mortality, and also they are going to reach sexual and reproductive rights. Thank you. Finally, Fernando, I wanted to do a call to action that, besides the things I have been mentioned, this is added to staff, to all the authorities of health. It's important to articulate the different services and efforts in the different institutions to be able to take advantage of the opportunity in this kind of events. Thank you very much. Thank you to all the participants. We all invite you to go to our websites so you have access to the 9 reports that are going to be given on this initiative. We also invite you to get together in the sector where you are to promote immediate contraception after events. I'm going to finish with a warm greeting, and all the work is being done in Latin America and the Caribbean with the regional fund. And we finish now. Thank you very much.